We are collaborating a team in Singapore and a team in Hong Kong to look at the HIV molecular epidemiology in both countries. What we are interested in looking at particularly is rates of virologic suppression of HIV and resistance-associated mutations as measured by genotyping in both populations. We hope that by determining the differences in molecular epidemiology and resistance-associated mutations, we can draw some conclusions. For example, looking at the funding structures in Singapore and Hong Kong and what's allocated for HIV care and medications, also routine investigations and monitoring of treatment can have an impact on how patients can afford the medication and the treatment. And if there is an impact on the resistance that's generated, hopefully we'll be able to advocate for more funding that can be put into the care of HIV patients. We think it's particularly relevant. We're looking at a disease that's a chronic disease, but also has impact not just on the individual patient, but also on wider public health aspects. And determining the kind of funding structure for specifically for medications and for monitoring can have an impact, again, both on individual patients, but possibly also on public health, since it is a communicable disease, both in terms of healthcare financing and healthcare governance. I think those particular areas that NIHA is interested in, we are also interested in to see how we can benefit those areas for HIV care.